I think that I'm really lucky in this role as a spine surgeon. I can care for patients in the hospital and be doing research that is going to change the way that we actually practice medicine.
I've got the best job in the world, looking after patients in the ICU who are all critically ill, so patients on life support.
I love being a neurologist. The brain is a huge part of people's identity. It is so impactful in terms of what they're able to do day to day.
I grew up in Regina, Saskatchewan, and it was a real passion of mine to play hockey. When I was a medical student, I actually didn't really know what I was going to do. And when I did my rotation on spine surgery, we had a young hockey player come in that had been injured, was paralyzed from the neck down. So that really, got me, I think, very interested in pursuing, the scientific knowledge to try to make a difference in that.
I am curious about a lot of different things and I love to learn. My aunt and my mom were both physicians in China, so I think there was a lot of examples of really impressive women who were in the medical field, and so that career was always at the back of my head.
ICU is this melting pot of all the experts in the hospital coming together to approach the most complex patients and coming up with a unified plan. Intensive care is this privilege and opportunity to be invited into a patient, family, and their friends' worst time of their lives and to make it a positive experience. And I think that that's the greatest challenge, but when that does happen, it's the greatest pleasure.
VGH and UBC hospitals are the home of the most specialized adult healthcare in British Columbia. These knowledge and thought leaders are highly sought after by the top medical and research centers around the world. Donations improve the care that all patients receive because essentially by attracting the best people and funding their research in some cases, we get the very best cutting edge care. And this means better healthcare for you here in Vancouver when you need it.
The support and the care that I feel from my colleagues is one of the main reasons why this job is worth it, despite all the long hours.
I've got an amazing family. My wife is very supportive. She, I think, has similar hopes and dreams that we can do something meaningful for patients with spinal cord injuries. I think as somebody who does both clinical work and scientific work, people talk a lot about, translating this from the laboratory bench and bringing them to the bedside. But we think that actually taking problems that we see at the bedside and then going back to the bench to try to understand those better, create solutions based on questions that are really applicable to patients. And donor funding is so important at so many different levels. We want our patients to have access to the latest technology, the most innovative approaches like the living lab. And we want to actually be pushing the envelope for actually driving those innovations, those treatments, those discoveries.
I think certainly when I see my daughter and think she's going to be growing up and living her life here, you want to leave also an impact on making the healthcare in our community as good as possible. Philanthropy is this opportunity that our healthcare has to get cutting edge, innovative technologies, techniques to the patients of British Columbia.
Your donations fund research and hospital chairs that have ensured Dr. Kwon's groundbreaking spine research and discovery stays here in British Columbia. Donor funding for technologies, fellowship, and research funding have attracted the talent and created an environment for Dr. Sekhon and the ICU medical teams to have some of the best patient outcomes in the world. And thanks to donor funding, clinical and research fellowships attract talented early career surgeons and physicians like Dr. Zhao to Vancouver to advance research, deliver patient care, and see the possibility of building a world-class medical and research career here in Vancouver.
To all the donors that supported neuroscience, clinical care, and research, your support has made a huge difference in terms of my education, the type of specialty expertise that I'm able to provide patients, and also is doing the type of research that I think will have a huge impact.
Your impact on healthcare doesn't just stop with your donation. That gift that one gives grows over time. So for example, an initial $30,000 donation that led to the purchase of the brain bolt, Jamie, who's on her way to the 2018 Winter Olympics, and she had a very severe brain injury. So we placed the brain bolt in her for the first time, and subsequently she made a great recovery. So your donation grows in terms of the training of the next generation's experts and personnel, and also the delivery into a patient's journey. And I think it's really important for donors to know that we respect your gift, we honor it, and we try to grow it.
Thank you for supporting VGH and UBC Hospital Foundation.
Please give generously.
Together, we lead.
Together, we transform healthcare.